Most people who drink coffee every single morning have absolutely no idea what is quietly happening inside their kidneys. And what I am about to share with you is not a scare tactic. It is a real pattern that doctors, including kidney specialists, are increasingly seeing in their patients, especially in people over the age of 40. Here is the thing. Coffee is one of the most widely consumed beverages in the entire world. Over 64% of American adults drink at least one cup every single day. And for most of us, it feels completely harmless. You wake up, you brew your cup, and you go about your day. But what if that daily habit, the one you have done for years, maybe even decades, is slowly doing something to your kidneys that you would never notice until it is too late? Here is a number that should stop you in your tracks. The National Kidney Foundation estimates that around 37 million Americans are living with chronic kidney disease right now, and an alarming majority of them have absolutely no idea. No symptoms, no warning signs, nothing. Just silently, quietly, the damage builds. And while coffee is not the only factor, the timing of when you drink it, how much you drink, what you drink it with, and what condition your body is already in when that first sip hits your system, all of that matters far more than most people realize. So before you reach for that next cup, stay with me for the next few minutes, because what you are about to learn could genuinely change how you think about your morning routine forever. Now, let us start with something that surprises almost everyone. Most people assume the question is simple. Is coffee good or bad for your kidneys? But the real answer is actually both, and the difference comes down to how you drink it. Here is what the science shows. Coffee, in moderate amounts, actually contains antioxidants called chlorogenic acids that can reduce oxidative stress in the body. Some research has even suggested that moderate coffee consumption may lower the risk of kidney stones in certain populations. So at first glance, coffee looks like it might actually be protective. But here is where things get complicated, and where a lot of people make a very serious mistake without even knowing it. The kidneys are responsible for filtering your blood. Every single minute of every single day, your kidneys are processing about 1 cup of blood, removing waste, balancing fluid levels, and making sure your body stays in chemical balance. They are remarkable organs, but they are also deeply sensitive to one specific thing: dehydration. And this is where coffee becomes a real problem for millions of people. You see, caffeine is a diuretic. That means it signals your kidneys to release more water. When you drink a cup of coffee, your body does not just absorb that liquid and stay balanced. Instead, it actually loses more fluid than it takes in, especially if you are already mildly dehydrated, which most Americans are when they wake up in the morning. Think about it. You have just spent 7 or 8 hours sleeping, breathing, and sweating slightly without taking in any water at all. Your body wakes up already in a mild state of dehydration, and then the very first thing millions of people do is drink a diuretic. Your kidneys, which are already working hard on reduced fluid, now have to kick into overdrive to process that caffeine load. Over time, repeated morning dehydration from coffee, without compensating with water, creates a chronic low-level strain on the kidneys that most people never feel until it shows up on a blood test years later. But that is just the first layer of this story, and honestly, it is not even the most important one. Keep watching, because in just a moment I am going to tell you about something much more specific that happens with coffee and kidney health that even most doctors are not spending enough time warning their patients about. Let us talk about something called kidney filtration rate, or what doctors call your GFR, glomerular filtration rate. This is the number that tells your doctor how well your kidneys are actually doing their job. A healthy GFR is above 60. When it drops below that number, you are officially in chronic kidney disease territory. And here is what makes this so dangerous. GFR can decline for years, even decades, before you ever feel a single symptom. No pain, no swelling, no fatigue, nothing that would make you think something is wrong. And during all of those years, the choices you make every morning, including what you drink first, are either protecting those filtration units in your kidneys or slowly wearing them down. Now, one of the most overlooked connections between coffee and kidney health involves something most people are not even thinking about, and that is what you are putting inside the coffee. This is the part that I really need you to pay attention to. Plain black coffee in moderate amounts is generally not the problem for most people with healthy kidneys. The research on this is fairly consistent. But the moment you start adding creamers, artificial sweeteners, flavored syrups, sugar, or those packaged coffee drinks loaded with sodium and additives, the picture changes dramatically. Let me explain why. Many popular coffee creamers contain a compound called phosphate additives. Phosphate is a mineral your kidneys need to filter out of your blood. In healthy kidneys, this process is routine and effortless. But the kidneys of someone with early or undiagnosed kidney disease struggle to clear phosphate efficiently. When phosphate builds up in the blood, it starts to pull calcium out of bones, weakens them, and contributes to calcification in blood vessels. The problem is that these phosphate additives are not labeled in a way that makes them obvious. They appear on ingredient lists under names like sodium phosphate, disodium phosphate, potassium phosphate, and phosphoric acid. Most people have absolutely no idea they are consuming high amounts of these additives every single morning, and because they feel fine, they never question it. There is also the issue of blood pressure. Caffeine causes a short-term spike in blood pressure every time you consume it. For most young, healthy adults, this temporary spike is not a major concern. But for adults over the age of 40, particularly those with any degree of hypertension, which the CDC estimates affects nearly half of all American adults, that daily spike adds cumulative stress to the tiny blood vessels inside the kidneys. These vessels, called glomeruli, are incredibly delicate. They are essentially the filtration units of the kidney. And consistent blood pressure spikes, even small ones that happen repeatedly over years, can damage those vessels in ways that are permanent. Now, here is something that may surprise you, and this is one of those pieces of information that I think is genuinely underreported. Many people who develop kidney problems from dietary and lifestyle habits do not have a dramatic decline. Their kidneys do not suddenly fail one day. Instead, they experience what researchers call a gradual functional decline, a slow, barely measurable drop in kidney function that goes undetected because the kidneys have an extraordinary capacity to compensate. One kidney can do the work of both. Your kidneys can lose up to 40% of their function before your blood tests show anything abnormal. This is why so many people are blindsided by a diagnosis of kidney disease at a stage where the damage is already significant. So what does this mean for coffee? It means the risk is not obvious. It is not immediate. You are not going to drink 3 cups of coffee today and feel your kidneys hurting tomorrow. This is a slow accumulation, and that is exactly what makes it so dangerous for so many people, especially those who have never had any reason to think about their kidneys at all. Let us now talk about the timing issue, because this is something I see very few people discussing, and it is genuinely important. Your cortisol levels, the hormone your body produces naturally to wake you up, peak sharply between approximately 8 and 9 in the morning for most people. Cortisol is already giving your body an energy boost during that window. Your kidneys and adrenal glands are both working hard during this time. When you add caffeine on top of that cortisol peak, you are essentially doubling the stimulation signal. The caffeine has less effect on your energy, your body builds tolerance faster, and your adrenal glands and kidneys are taking on a combined load that they were not necessarily designed to handle repeatedly, day after day, year after year. This is why many functional medicine practitioners recommend shifting your first cup of coffee to later in the morning, after about 90 minutes to 2 hours of being awake, once your natural cortisol peak has started to come down. The caffeine then has a more genuine effect on your energy because it is not competing with cortisol, and your kidneys get a morning window to rehydrate and process last night's metabolic waste without the diuretic interference. It sounds like a small thing, but for many people, this single timing shift makes a noticeable difference in how they feel, their energy levels throughout the day, and in theory, it reduces the accumulated stress on kidney function over the long term. Let us also talk about quantity, because this is where a lot of confusion exists. Research from major institutions, including Harvard School of Public Health, has found that moderate coffee consumption, roughly 2 to 3 cups per day, is associated with neutral to slightly positive effects on kidney function in people with healthy kidneys. But the word moderate is doing a lot of heavy lifting in that sentence. The average American coffee drinker actually consumes more than 3 cups per day, and many people consume 5, 6, or even more. At those quantities, the diuretic effect becomes significant, the blood pressure impact becomes cumulative, and the additive load from creamers and artificial ingredients compounds rapidly. There is also a particularly important consideration for people who take over-the-counter pain medications regularly, things like ibuprofen or naproxen. These medications are classified as NSAIDs, and they work by reducing inflammation in the body. But one of their well-documented side effects is that they reduce blood flow to the kidneys. When you combine chronic NSAID use with habitual high-volume coffee consumption and the dehydration that comes with it, you create a perfect storm of reduced kidney blood flow, increased filtration demand, and fluid imbalance. This combination is one of the leading contributors to what is called analgesic nephropathy, kidney damage caused by pain medication, and it is something millions of Americans are unknowingly doing to themselves every single week. Now, I want to be very clear about something. I am not here to tell you that coffee is your enemy. For many people, coffee can absolutely be part of a healthy lifestyle. There is real research suggesting benefits for cognitive function, liver health, and even certain metabolic conditions. The goal is not to frighten you away from your morning cup. The goal is to make sure you are drinking it in a way that works with your body, not against it, and specifically, not against those two incredibly hard-working organs sitting just below your rib cage on either side of your spine. Here are the things that genuinely matter if you want to protect your kidneys while still enjoying coffee. First, drink water before coffee. This one habit alone can significantly offset the dehydration risk. Before you brew, drink at least 1 full glass of water, 8 to 16 ounces. Give your kidneys that window to begin their day hydrated. Second, read your creamer labels. If you see any form of phosphate in the ingredient list, consider switching to a simpler alternative, whole milk, oat milk, or almond milk, all of which have far fewer kidney-stressing additives. Third, monitor your total daily caffeine load. If you are consistently consuming more than 400 milligrams of caffeine per day, which is roughly 4 standard cups, you're in territory where the long-term kidney impact becomes more measurable, especially as you age. Fourth, and this is one of the most important pieces of advice I can give you, get your kidney function checked. A simple blood test called a comprehensive metabolic panel, which your doctor can order in any routine visit, will show your creatinine levels and your estimated GFR. These are the numbers that tell you the real story of how your kidneys are functioning. Most people have not had this test since their last physical exam, and many have never had it at all. Given that 37 million Americans have kidney disease without knowing it, this is one of the most valuable preventative health actions you can take. It takes 5 minutes and could genuinely change the course of your health. Fifth, think about what you eat around the time you drink coffee. A coffee habit combined with a high-sodium breakfast, processed meats, canned foods, fast food, is an especially problematic combination for kidney health because sodium forces your kidneys to work harder to maintain fluid balance, and when that is layered with caffeine-induced dehydration, the combined effect is significantly greater than either factor alone. There is one more thing I want to mention before we wrap up, and I think this one is worth sitting with. A lot of people my age and older grew up in a world where nobody talked about kidneys unless something dramatic went wrong. The liver gets all the attention, the heart gets all the attention, the brain gets all the attention. But the kidneys are quietly doing one of the most physically demanding jobs in your entire body every single minute of your life, without complaint, without obvious symptoms, and without anyone paying much attention until the damage is already done. They deserve better than that. They deserve for us to know their story and understand how our daily habits, even the ones that feel completely harmless, are either supporting them or silently eroding them over time. The good news is that the kidneys are also remarkably resilient. With the right changes, even kidneys that are showing early signs of stress can stabilize and, in some cases, even partially recover their function. The story is not over until it is over. And for the vast majority of you watching this right now, the story is still very much in a chapter where the choices you make today can meaningfully shape the outcome you experience 10, 15, or 20 years from now. I want to hear from you now. This is genuinely one of those topics where your personal experience matters more than you might think. Have you ever been told your kidney function numbers were off? Do you have a family history of kidney disease? Or are you someone who has been drinking 5 or 6 cups of coffee a day for years, and this is the first time you have thought about what it might be doing to your kidneys? Drop your story or your question in the comments below. I read every single one. And sometimes the most valuable information in a video is not what I say, but what someone in the comments shares from their own real life. Your experience could genuinely help someone else watching this who needed exactly that perspective. Share this video with someone you care about, especially someone who drinks coffee every morning and has never thought about what it means for their kidney health. Because the truth is, most people are never going to hear this from their doctor in a regular 10-minute visit. This might be the only time they hear it, and that small act of sharing could matter more than you know.